Did you know that sensation of heaviness or pain in your legs, which we often attribute merely to tiredness or age, can actually be a cry for help from your circulatory system? Poor circulation is not just an aesthetic or passing discomfort. If ignored, it can evolve into serious conditions like thrombosis or ulcers that do not heal. Many men and women over 50 live with these silent signs daily, without knowing that the body is giving clear warnings that blood is not reaching where it should with the efficiency necessary to keep their health on track. In this video, I will show you exactly how to identify the symptoms of poor circulation, differentiating what is normal from what is dangerous, and most importantly, I will teach you what to do to treat and relieve these symptoms. Stay with me until the end, because the information I will share here can save the mobility of your legs and ensure that you continue walking with independence and without pain for many years. Let's get straight to the point, starting with the most common sign that most people let slip by. The silent symptom, swelling and heaviness, the first and most frequent sign that the return of blood from the legs to the heart is compromised, is the sensation of excessive heaviness, especially at the end of the day. It is as if you were carrying lead ankle weights, accompanied by swelling that causes the sock mark to stay deep in the skin or makes your shoes feel tight in the afternoon. This swelling, called edema, occurs because the veins have lost the ability to pump blood against gravity, causing fluid to accumulate in the lower tissues, generating discomfort and that sensation of extreme tiredness. Do not ignore it if you wake up with light legs and go to sleep with them swollen and heavy, as this indicates venous insufficiency that needs immediate attention before it worsens. This untreated fluid accumulation overloads the lymphatic system and the skin, potentially leading to permanent changes in the texture and health of your legs. Understanding this mechanism is the first step to avoiding major complications, and there are simple ways to relieve this that we will see later. But first, I need you to pay attention to the color of your skin, which is our next point. If you want to keep receiving clear and direct guidelines on how to take care of your health and age with quality of life, take the opportunity now to click the like button and subscribe to the channel. That way, YouTube understands that this content is relevant to you and notifies you whenever I post a new video about essential care. Skin color speaks. The appearance of the skin on your legs and feet is a powerful visual indicator regarding the quality of your blood circulation that you can check right now at home. When arterial circulation is poor, meaning oxygen-rich blood has difficulty reaching the feet, it is common to notice excessive paleness when you elevate your legs or an intense dark redness when you put them down. Additionally, the skin may become thinner, shiny, and with less hair because the lack of nutrients prevents the normal growth of follicles and cellular renewal. On the other hand, if the problem is in the blood return, the veins, you may notice a more brownish or ochre coloration, mainly in the ankle region, which we call stasis dermatitis or ochre dermatitis. This happens because the blood stays stagnant and the iron from the blood cells leaks into the skin, causing this permanent stain. Observing these color changes is vital, as they precede more serious problems. But beyond what you see, there is what you feel in skin temperature, which is a critical alert I will explain next. Temperature and sensitivity. Do you feel your feet constantly cold, even when the weather is mild or when you are bundled up? Persistent coldness in one or both feet is a classic sign of poor arterial circulation, indicating that warm blood flow is not reaching the extremities adequately. Often, this comes accompanied by a sensation of tingling or numbness, that feeling of ants crawling on the legs, which occurs because the nerves also suffer from the lack of blood irrigation and begin to fail in transmitting sensations. This change in sensitivity is dangerous because, over time, you may lose the ability to feel small injuries, pebbles in your shoe, or cuts, which is a huge risk, especially for those who have diabetes. Numbness is not normal and should not be accepted as an age thing. It is a warning that circulation needs help. Now, if besides the cold and tingling, you feel a specific pain when walking that forces you to stop, pay close attention to the next topic, as this is the most characteristic symptom of peripheral artery disease. The confusing pain. Intermittent claudication. There is a type of pain in the calf that is very specific and serves as a major red alert. It appears when you walk a certain distance and disappears completely when you stop to rest. This phenomenon is called intermittent claudication and acts like an angina of the legs. The muscle asks for more blood to move, but the clogged arteries cannot supply it, generating a cramp or intense pain that forces you to stop. As soon as you rest, the demand for blood decreases and the pain passes, creating a vicious cycle. Many people confuse this with joint problems, arthritis, or lack of physical fitness, and end up stopping walking, which only worsens the circulation situation. Differentiating this vascular pain from common muscle pains is fundamental to seek the correct treatment with a vascular surgeon. If you notice that you always need to stop walking at the same point on the way to the bakery or on your daily walk, this is not tiredness, it is poor circulation. And speaking of visible signs, we cannot forget the famous varicose veins, which go far beyond aesthetics. Take a moment to check if you are already subscribed to our channel and turn on the notification bell. Doing this ensures you don't miss any vital information about your health and also helps our community grow, taking this knowledge to more people who need to take care of themselves. Leave a like if you know someone who complains about these leg pains. Varicose veins and spider veins. Varicose veins are dilated and twisted veins that have lost the function of their internal valves, allowing blood to flow back and accumulate in the legs instead of going up to the heart. Although smaller spider veins are often just an aesthetic complaint, thick varicose veins, those that bulge out on the skin, indicate chronic venous hypertension that can cause pain, burning, and a constant sensation of heaviness. They are visible proof that your leg's plumbing system is failing and needs repair to avoid clot formation. It is important to understand that having varicose veins increases the risk of thrombophlebitis, which is vein inflammation with clot formation, and, in more serious cases, deep vein thrombosis. Do not view varicose veins merely as a beauty problem. They are a venous disease that requires the use of elastic stockings or medical procedures for correction. But poor circulation does not appear out of nowhere. It is fueled by hidden risk factors that you might be cultivating without knowing. And that is what we are going to talk about now to nip the problem in the bud. Hidden risk factors and lifestyle. Poor circulation in the legs is generally the result of years of aggression to the blood vessels provoked by conditions like high blood pressure, high cholesterol, diabetes, and, primarily, smoking. Cigarettes are the biggest enemy of arteries, as they harden vessel walls and favor clogging, while uncontrolled diabetes damages both vessels and nerves, creating a dangerous combination for lower limb health. Furthermore, a sedentary lifestyle atrophies the calf pump, the calf muscle responsible for propelling blood back to the heart. Identifying if you fit into these risk groups is essential for treatment, because there is no point in treating the leg if we do not treat the base cause, like controlling glucose or quitting smoking. Overweight also exerts extra pressure on the veins, hindering venous return. Correcting these factors is the foundation of any significant improvement. If these factors are not controlled, the condition can evolve to the most feared stage of poor circulation, wounds that do not close, which we will see next. The danger of wounds. Ulcers, the most advanced and worrying stage of poor circulation, manifests through wounds on the leg or foot that take weeks or even months to heal, known as vascular ulcers. When blood doesn't arrive with nutrients, arterial insufficiency, or gets dammed up poisoning the skin, venous insufficiency, any small scratch can become an entry point for bacteria and evolve into a chronic and painful wound. These ulcers are difficult to treat and require intensive medical care and specialized dressings. Prevention is the absolute key here, because once the ulcer opens, the patient's quality of life drops drastically due to pain and movement limitation. If you notice that a cut on your foot is not healing or that a spot on your leg is opening into a wound, seek medical help immediately. Do not try to treat it with home remedies. Now that you know the severe alerts, let's focus on the solution. What you can do practically, starting today, to improve your circulation and avoid all this. Is this content being useful to you? Then, consider becoming a member of our health family by clicking subscribe. Your subscription is the fuel for me to keep bringing these medical alerts for free and accessibly. Leave a thumbs up to support the channel. Practical solutions and treatments. The good news is that there are very effective measures to improve circulation, starting with movement. Walking is the best medicine as it strengthens the calf, which pumps blood. Additionally, elevating your legs for 15 to 20 minutes, 3 times a day, above heart level, helps drain accumulated fluid and relieves heaviness almost instantly. The use of compression stockings, when prescribed correctly by a doctor, works like a second skin that tightens the veins just right, facilitating blood return and preventing swelling. From a medical standpoint, there are medications that improve vein tone and blood fluidity, in addition to minimally invasive procedures to dry up spider veins or treat larger varicose veins, such as laser or foam. Staying hydrated is also fundamental, as water helps keep the blood at an adequate viscosity, preventing clots. Small changes in routine, like avoiding staying still in the same position for many hours, whether standing or sitting, make a monumental difference in the health of your legs in the long run. Conclusion and action plan. Having good circulation in the legs is synonymous with freedom and autonomy in old age. Identifying signs like swelling, skin color changes, cold feet, pain when walking, or varicose veins should not be a cause for panic, but rather a signal for immediate action. The human body is a perfect machine that warns us when something is wrong, and ignoring these warnings is the biggest mistake we can make. Consult an angiologist or vascular surgeon for a checkup, especially if you are over 50. Start your action plan today. Walk a little more, drink more water, control your risk factors, and observe your legs with care. Prevention is always the cheapest and least painful treatment. I hope this guide has cleared your mind and motivated you to take better care of yourself. Take care of your legs, for they are responsible for taking you everywhere life happens. If you liked this video and want to take care of your health holistically, don't leave without subscribing to the channel and turning on the bell. I prepare every piece of content thinking about your well-being. Leave a like and share this video in the family group, because this information can help many people. A big hug, and see you in the next video.